This content is for informational purposes only and does not replace professional medical advice. Always consult a qualified healthcare provider for personal health concerns. Imagine a vast, intricate network of highways running beneath your skin, delivering life-sustaining oxygen and nutrients to every corner of your body. Now picture a slow, invisible accumulation forming along those pathways, thickening the walls from within. This is the paradoxical nature of cholesterol, a substance that is fundamentally essential for your survival, yet capable of becoming a silent architect of cardiovascular decline if left unchecked. It is easy to categorize cholesterol as a simple villain in the story of heart health, but the biological reality is far more nuanced. It is a waxy, fat-like molecule that your body uses to build cells, synthesize vital hormones, and produce vitamin D. Without it, your internal systems would essentially grind to a halt. However, when the delicate balance of these lipid molecules shifts, the consequences can be profound. Many people associate high cholesterol levels exclusively with aging or poor dietary habits, yet studies indicate that the foundational markers for heart health are often established much earlier in life than we might expect. The danger lies not in the cholesterol itself, but in the environment we provide for it to circulate. When certain types of lipids remain in the bloodstream for extended periods, they can become trapped, leading to the development of plaque, the true catalyst for the complications many of us fear. We are going to peel back the layers of this biological mystery to understand what is actually happening beneath the surface. By moving past the common myths and focusing on the mechanisms of vascular health, we can gain a clearer picture of how to maintain our internal systems effectively. Let's look at the mechanics behind the flow. To understand how these lipids navigate your bloodstream, we first need to strip away the stigma often attached to the word cholesterol. Think of it as a fundamental building block. Every single cell in your body relies on cholesterol to maintain the integrity of its outer membrane. It is also a precursor to vitamin D, which is vital for bone health and immune regulation. The problem arises not from the existence of cholesterol itself, but from the logistics of its delivery. To travel, it must be packaged into carriers called lipoproteins. This is where the famous distinction between LDL and HDL comes into play. Research suggests that when there is an excess of LDL circulating in the blood, it can begin to deposit into the inner walls of your arteries. Over time, these deposits can accumulate, potentially narrowing the vessel and restricting the smooth passage of blood. Conversely, high-density lipoprotein, or HDL, serves as the body's internal cleanup crew. Medical professionals often describe HDL as a scavenger because it actively collects excess cholesterol from your tissues and bloodstream, transporting it back to the liver to be processed and eventually excreted. It is important to recognize that your body is constantly working to maintain this balance. Genetic predispositions, dietary habits, and lifestyle factors all influence how efficiently these transporters function. However, understanding the molecules themselves is only half the story. To see how these microscopic interactions escalate into physical changes within your arteries, we need to investigate the process of plaque formation and the inflammatory responses that follow. This transition into the arterial wall is where the biological narrative truly intensifies. Imagine your blood vessels as sophisticated, resilient conduits, lined with a slick, protective layer called the endothelium. However, certain triggers can compromise this barrier, creating what researchers often describe as a perfect storm. Genetics act as the baseline here. While you cannot alter your DNA, these inherited traits dictate how your body processes fats long before you make your first lifestyle choice. When you layer a diet heavy in saturated and trans fats onto this genetic foundation, the liver's capacity to regulate cholesterol becomes overwhelmed. As we age, the cumulative effect of these factors becomes more pronounced. Over decades, the endothelium may face repeated insults from systemic inflammation, high blood pressure, or oxidative stress. Once trapped there, these lipids undergo a chemical transformation, becoming oxidized. This oxidation is the spark that ignites a chronic immune response. In a protective but ultimately counterproductive move, white blood cells, specifically macrophages, rush to the site to engulf the oxidized cholesterol. These cells become bloated with lipids, eventually turning into what scientists call foam cells. These cells accumulate, forming a fatty streak along the inner lining of the artery. Over time, this fatty streak evolves into a complex plaque, covered by a fibrous cap. If this cap remains stable, the artery may continue to function, albeit with a narrowed interior. Understanding why this structure shifts from a stable deposit to an unstable vulnerability requires us to look at the mechanical stress and chemical signals that dictate whether these plaques remain silent or become a focal point of clinical concern. But here is the most deceptive aspect of this entire process. While these structural changes occur deep within your vasculature, your body often provides no immediate feedback. You might feel perfectly energetic and healthy while these plaques are quietly accumulating, which is exactly why waiting for a symptom to appear is a dangerous strategy. By the time the body signals that something is wrong, the underlying damage is often quite advanced. This is where the clinical manifestations of atherosclerosis emerge. If the narrowed vessels are supplying your heart, you may experience angina, which is the medical term for chest pain or discomfort. It is a direct consequence of your heart muscle struggling to receive the blood supply it needs to meet the demands of movement. The impact is not limited to the heart, however. You might notice cramping in your legs while walking, a condition known as claudication. This pain often occurs in the calves or thighs and typically forces a person to stop moving until the discomfort fades. These are not merely aches or signs of aging. They are physiological distress calls indicating that the delivery system for your body's tissues is being compromised. It is vital to understand that these symptoms are not the start of the disease, but rather the result of a long-term progression. Research suggests that plaque instability is far more dangerous than the size of the plaque itself. A smaller, inflamed deposit can be just as volatile as a larger, more calcified one, especially if it ruptures and triggers an immediate internal response. By looking at the specific markers circulating in your bloodstream, we can identify these risks while the arteries are still patent and the risk of a major event remains low. To truly understand why some plaques remain dormant for decades while others suddenly threaten your health, we need to examine the specific environmental triggers that cause these stable structures to suddenly become unstable. While those triggers are critical, the most empowering realization is that you are not a passive observer of your own biology. Once you have a clear picture of your lipid profile, you gain the ability to intervene. When we look at diet, the goal is not merely restriction, but rather shifting toward a profile that supports healthy cholesterol transport. Studies indicate that prioritizing soluble fiber, found in abundance in oats, legumes, and certain fruits, helps trap cholesterol in the digestive system before it ever enters your bloodstream. Simultaneously, replacing saturated fats with unsaturated fats, such as those found in olive oil, walnuts, and fatty fish, appears to help the liver clear LDL particles more efficiently. Exercise serves as an equally potent tool. Beyond the general benefits of cardiovascular fitness, regular physical activity has been shown to influence how your body handles lipids. Engaging in consistent aerobic movement can help increase HDL, the particle tasked with carrying cholesterol away from the vessel walls and back to the liver for processing. However, sometimes lifestyle modifications alone aren't enough to reach your target goals, especially if your genetics play a significant role in how your body produces or recycles cholesterol. This is where medical interventions like statins become invaluable. These medications work by inhibiting the enzyme in your liver responsible for cholesterol production. It is a common misconception that these drugs are a substitute for healthy habits. In practice, they are often most effective when paired with the dietary and exercise foundations we've discussed. Managing your heart health is a long-term commitment, not a short-term sprint. It is about building a sustainable framework that works for your specific physiology. As we move into the final part of our discussion, we have to address the hidden influence of systemic inflammation and how it dictates whether your efforts are truly succeeding at the microscopic level. That hidden influence of inflammation brings us to the frontier of modern cardiology, where the landscape of heart health is shifting from reactive management to proactive precision. We are currently witnessing a revolution in how we address lipid metabolism, moving far beyond the traditional reliance on statins. Breakthroughs like PCSK9 inhibitors represent a paradigm shift, offering a biological shortcut to drastically lower LDL levels for those whose genetics have historically kept them at a disadvantage. These therapies, alongside emerging advancements in genetic screening, allow us to peer into the blueprint of your cardiovascular risk years before a problem manifests. We are entering an era of hyper-personalized medicine, where your treatment plan isn't just based on a general population average, but on the unique molecular signature of your own arteries. To synthesize what we have covered today, the narrative of cholesterol is not one of simple villainy. It is a story of balance, transport, and a complex interplay between your internal environment and the external choices you make. We have examined how these lipids function as essential building blocks, the necessity of maintaining structural integrity within your vessel walls, and the critical importance of keeping your systemic inflammation in check. Your heart health is not a static state, it is a dynamic process that responds to the consistency of your habits, the quality of your nutrition, and your willingness to stay informed about your internal biomarkers. The most powerful tool at your disposal remains the regular blood panel. It serves as your primary data stream, providing the objective evidence needed to navigate your wellness journey with confidence. By tracking these metrics over time, you transform guesswork into a strategy, allowing you to see exactly how your lifestyle adjustments translate into tangible, long-term protection. This content is for information. Please consult a doctor for health concerns. Thank you for spending this time with me, and I hope you continue to take thoughtful, informed steps toward a healthier, more resilient future.